For our value proposition, we are doing Rings of Relief, a new approach to endometriosis treatment. My name is Abby Rivers.
I'm Emma Record.
I'm Leah Johnson.
And I'm Lily Kirkpatrick.
To begin, what is endometriosis? It is a chronic gynecological condition where endometrial tissue grows outside of the uterine cavity. This misplaced tissue is prone to inflammation and can cause symptoms such as pain, abnormal periods, fatigue, as well as infertility. For some, this condition can cause productivity loss at work, amounting to around 10.8 hours a week, primarily due to the debilitating pain. These symptoms may also lead patients to develop psychological disorders such as anxiety and depression. Endometriosis affects approximately 11% of women who are of reproductive age, which amounts to around 8.6 million women in the US alone. While there are options for managing this condition, including hormonal birth control, medications for pain management, and surgery to remove misplaced tissue, these methods are not effective for all patients. Following treatment, 11 to 19% of women do not experience reduced pain levels, and 5 to 59% of women have pain that persists even after treatment. In addition, some hormonal treatments and pain medications can increase the risk of developing ulcers. Finally, patients who undergo surgeries such as laparoscopies or hysterectomies are at risk of surgical complications and potentially recurrence following the incomplete removal of endometrial tissue.
So, what are the current treatments for women's reproductive health in relation to endometriosis? So, first we have the levonorgestrel IUD, which is an invasive procedure that is very painful but is localized in its treatment. It has to be conducted in a clinical environment and can last up to 10 years, depending on the type of IUD the user gets. It is more expensive, making it a downside. Another downside to this in relation to endometriosis is that it does not directly treat endometriosis and just deals with contraception and menstruation patterns. In addition, there are also oral contraceptive pills available. This price is significantly less than the IUD, but it does have to be taken orally daily, introducing systemic side effects since it is an oral drug and can spread to all your body instead of just localized at the source in the uterus. And for endometriosis specifically, there is oral danazol available. However, this is quite costly for a 6-month supply. It is not widely available, and it is also a systemic approach as well instead of just localized at the source. So taking this orally introduces other complications that can arise from taking the drug.
So moving into our solution, our proposed solution is the polyurethane drug-eluting ring. So for polyurethane, it's a high class of polymer with high biocompatibility, and it's very resistant to oxidative degradation, as well as it typically won't degrade before 42 days, and it's going to have an elastic modulus of about 25 megapascals. And we decided on a ring because there are similar rings that exist on the market right now for birth control methods. But they don't target specifically endometriosis, so we decided to take that and kind of change it around a little bit to target endometriosis specifically. Our ring is going to elute the drug called danazol. It's a synthetic steroid similar to testosterone, and it is anti-gonotropic and used for endometriosis currently, as Leah had previously said, orally. And how danazol works is it inhibits steroidogenesis in the ovaries, minimizing endometrial tissue growth. So our ring is going to be vaginally inserted. The host will be able to insert them themselves without the need for any type of procedure in the clinical setting, and the ring will remain inside the host for about 3 weeks. In the ring, we're going to load 2 grams of danazol in it so that it'll have a regulated release of about 95 milligrams dispensed into the body daily, and this is going to be diffused into the vaginal mucosa, and then the host will remove it and replace it on their own. So instead of going orally and going through the entire system, it'll be local administration of the drug.
One of the current leading treatments for endometriosis is laparoscopic surgery, which surgically removes endometrial lesions and costs anywhere from $2,500 to $7,500. An annual healthcare cost and cost of productivity loss associated with endometriosis have been estimated to be about $1,000 to $3,000 per patient. Our solution is a cheaper alternative for endometriosis treatment for 2 reasons. One is because it is made of cheap and widely accessible polyurethane, which costs about 13 cents per centimeter squared and brings the total cost of polyurethane for our ring to be about 5 cents per ring. Another reason why our solution is cheaper is because we're administering danazol locally instead of orally. The cost of danazol per month is approximately $40 orally, and we can expect our cost of danazol to be even lower through local administration of the drug. That brings the total cost of our Danazol ring to be about $5.05 monthly, as compared with oral Danazol, which costs about $37.50 monthly.